Welcome to the next installment of the trainings regarding the Family Support Services, Family Reimbursement, ADM. We've made several updates over the last few months that we wanted to take some time today to go through and update everyone on. I'm going to move into the agenda for today. So we have a few things that we wanted to cover, a few brief introductions. We also have some of the background regarding why we made this latest batch of updates. A big piece of the presentation is going to go through some of the updates themselves that were released in June of 2024. Including updates on the allowable, non-allowable list, the ADM FAQs, and the some of the FR reconsiderations. And we also have proposed updates to some of the documentation, including the application and also the tracker and instructions that go along with the tracker. Brief introduction so you know who's part of the presentation and part of the FSS team. I am Nick Hobson. I'm the statewide FSS coordinator. Amy Burdick is our assistant statewide FSS coordinator. I always tell everyone you can always reach out to us, and we'll have some contact information at the end with any questions, comments, and concerns. Some of the background for these updates, going back to October of 2023, OPWD canvassed our FSS-FR providers statewide to capture their feedback, and we asked for their perspective and experience with FSS-FR following the implementation of the ADM back on July 1st of 2022. We shared the survey results with the FSS statewide committee in March of 2024. And the concerns were grouped into two broad categories: process issues and policy issues. Continuing along with more of the background on our updates, the providers reported several different things to us that we identified based on that survey. A big one being timeliness of the review and the decision on requests. We also were asked for guidance and additional training based on the ADM changes. The care manager specific duties, they noted an increased provider workload resulting from the ADM implementation, and there was more instruction and guidance asked for when it comes to clinical justifications. And in addition, some of the identified issues included documentation follow-through, process compliance, information sharing, and just general understanding of the ADM. Continuing on with our background for all these updates, OPWDD's work to streamline and expedite that decision-making process. And in order to decrease provider workload and offer standardized guidance, OPW has also been working, which we're going to get more into, simplifying the FSS Family Reimbursement Tracker and providing instructions that go along with that. And also developing an application or an instructions for the family reimbursement application. Contingent upon approvals, we will offer future training to communicate updates to families, providers, care managers, and various stakeholders. In other words, we'll continue to offer these trainings as we continue to make more updates. One other point that I wanted to mention, we received feedback to shorten turnaround times from submission to decision, so we definitely have heard that loud and clear. And once again, those tracker and application instructions will be available hopefully soon, and we will certainly let everyone know when they are made available on our website. Continuing with updates on the background for our updates. First, survey feedback. Some of the items and services excluded on both the allowable and non-allowable lists created the greatest reported issues from stakeholders. And some of the top identified items of concern from the non-allowable list were things such as incontinence items, mobility items, the purchase or replacement of mattresses, tracking and monitoring devices, and the repair, replacement of non-Medicaid covered items. In addition, in November of 2023, the statewide FSS committee members offered additional feedback regarding the non-allowable list and some of their concerns. And included on their list, they cited some of the same items as we received from other stakeholders, which include incontinence items, mattresses, noise-canceling headphones, and items that aren't covered by insurance. And taking all of that into consideration, and based on all of that collective feedback, OPWD responded with changes to both the allowable and non-allowable list and provided additional clarifications on the ADM. So moving along to the family reimbursement ADM updates themselves. First point, revisions have been made to the allowable, not allowable list to allow for greater flexibility. And a sub-note that is important to keep in mind, the intent of the list remained to provide guidance and establish parameters for statewide consistency. So despite undergoing periodic updates, due to the individualized nature of FSS lists are not all inclusive. And providers are encouraged to seek out continued guidance from our regional field offices when questions arise. I think this is an important point because there's no way that we'll ever have a completely inclusive, exhaustive list of everything that can be reimbursed through FSS, but at the same time, we're going to continue to make the list as streamlined and as helpful as we can, but there's always going to need to be conversations and outreach between providers and the regional field office staff to be able to figure out what's appropriate when it comes to using this resource. FAQ updates have also been provided to clarify some of the common concerns and address questions identified by all of those groups I've mentioned. And the updated allowable, non-allowable list and the FAQ document were made available via the OPWDD website in June of 2024. So I'm going to get into some of the clarifications and changes on the allowable list to start. So we have, and I will say some of the items that you see that are bolded and underlined as we go through these slides are new things that have been added to the list, just so it's that much cleared and to be able to see some of those changes from the previous list. The first one is museum memberships, and some examples include museums that address sensory needs and also include some of the STEM museums, the science, technology, engineering, and math geared museums. In terms of this change and this clarification, the focus still remains on specific types of museums which would offer benefits related to the individual's IDD diagnosis. The next thing that's been added was skiing. The OPWDD recognizes the potential physical benefits associated with skiing as well as other sports as related to someone's IDD diagnosis and their needs. So this was something that was added along with a lot of the various other activities that you see on the list that have been previously allowed. The next thing are expenses associated with sports, and that may include things like lessons, equipment, rentals, lift passes, etc. And lastly, outdoor swings for sensory needs. And to this point, OPWDD recognizes the potential for sensory benefits of swinging for individuals of all ages related to their disability. And this has been extended so that both indoor and outdoor swings are allowable. Continuing on with clarifications on the allowable list, the next item was noise canceling ear coverings. Once again, the agency sees the benefit of ear coverings for those with sensory and auditory sensitivities. But of note, this does exclude coverings which play or remote sounds or music. So the things like earbuds or Bose headphones, these are specifically for noise canceling ear coverings. And also on this slide, we've added sensory activities specified and is related to developmental disability diagnosis. And this is inclusive of crafts, which was a previously approved allowable item or activity on the prior list. Once again, there's a recognition of, the sensory and fine motor skill benefit of activities like this. We recognize sensory activities can be diverse and individualized, but to remain allowable, activities must be driven and appropriately related to the individual's diagnosis, as opposed to those that are more recreational in nature. You will hear me say several times, about that connection to the disability for the individual, and that really is a key piece to, any reimbursement items. And that's not a new point, but I think it is important to reiterate as we have these series of trainings. Continuing on with the additional items and changes to the allowable list. This was just an error we made, but for respite and camp sections, they weren't listed quite correctly. So we there was an error with the section titles. It's a minor thing, G and H, which was resolved from the original ADM. So there's no actual changes to those respite or camp. It's just a minor grammatical error. The over-the-counter medications as related to the DD diagnosis, though, was added. And in addition, to further clarify this one, the over-the-counter OTC medications, once again, related to the individual's IDD diagnosis, need to be identified in their care plan. And also, they have to not be covered under Medicaid or other healthcare insurance, and also need to be approved by the FDA. OTC medications for healthcare issues unrelated to the diagnosis still remain the responsibility of the the family or the caregiver. And lastly on this slide, the replacement or repair of prescription eyeglasses or hearing aids, if denied by insurance and with proof. So again, as an agency, we recognize that items necessary for daily functioning may be damaged, lost, and do require replacement or repair over time. But the FSS funding may be allowable if it's not covered by Medicaid or other healthcare insurance and with notice of denial as proof. So I think the important point here is this something that can be allowed per FSS, but there has to be proof that insurance, won't cover it or can't cover it for whatever reason. So I think that's a big point to keep in mind if we're looking to take advantage of this item on the allowable list. So moving along with more allowable list updates. So clothing due to atypical needs as related to the person's developmental disability. We have made, I believe, a couple of updates to clothing along the way. In addition to what's here on the slide, the clinical needs related to the IDD, but that's always been part of clothing from the beginning. So in instances where individuals destroy clothing due to their behavior, or maybe are destroying clothing due to incontinence, we might also see things like clothing with specific fasteners for those with fine motor issues. Like those are all things where, we can see clothing being allowable. In terms of the documentation piece, the requirements, include, a life plan or addendum with the clinical need identified. And for those that do have life plans and receive care management services, we also would look for a plan to mitigate that behavior as much as possible, and any other additional supportive or requested documentation to substantiate the request. I said, so there's a lot to digest around clothing, but I think once again, if you look at the list, and also we haven't gotten to the FAQs part, there's a lot more guidance out there publicly now to help with the decisions and the how to view clothing and make sure that we're following the guidance properly. So in addition, some of the other information, that OBWDs provided guidance, as I've mentioned. 2 points on the slide that are also tie into all this. Clothing may be allowable if a request meets the health, safety, environmental, or functional needs. And unless the item is sufficiently justified, it remains the responsibility of the caregiver to provide basic clothing to children and adults in their care. So things like swimwear, undergarments, back to school clothing, those would remain an expected out-of-pocket expense, for the family or the caregiver. Like I said, there's a lot to digest when it comes to clothing, and this is a point that I will make at the end, but that's why our staff and the regional field office staff are also available to help with some of these clarifications on these things. Moving along to the next slide, we have a little bit more on the allowable list updates. Another change you'll see is related to incontinence items and supplies. In the absence of Medicaid or other third-party insurance, or if the quantity allowed is under insurance is exceeded. So it's really, once again, comes down to what insurance will cover when it comes to incontinence items, as well as what the quantity limits are. In addition, there's proof of insurance denial is required when submitting for incontinence-related items. And also, which we didn't get to yet, but incontinence supplies remain non-allowable for children under the age of 4 as a typical expense for caregivers for all children within that range. So you'll see, said, this is why I stress it's important to look at things together, because there are some items that are allowable, but there are caveats to those. So it's important to look at everything in conjunction. And second bullet on this slide, we also, protective mattress covers have been added. And those types of covers requested should adequately address the needs. So we'd see this in cases of covers to protect against bed bugs, waterproof covers to guard against incontinence. Things of that nature are what we're getting at when we are discussing protective mattress covers. Continuing down to a couple more, one more, I'll say, allowable list update. So mattress box spring purchase and replacement was added as allowable with a couple conditions. Allowable if the need is due to the documented incontinence issues, behavior challenges, or environmental hazards. And we list a couple of examples, which could include things like damage from a fire, bed bug infestation. The mattress funding remains non-allowable when it is outgrown due to routine wear and tear, as these situations are considered typical expenses for a family or a caregiver. And the frequency of mattress replacement is not to exceed once every 2 years. So with those are the allowable list updates that you'll see. Now we'll move into the non-allowable list updates. So bed protector was removed from the non-allowable list, as I mentioned in a previous slide. Prescription eyeglasses, if the criteria is unmet. So again, these are a lot of the examples that, just to point out, since they were added to the allowable list, we made sure to be very clear on the non-allowable side that these things are non-allowable if the criteria mentioned in the allowable list isn't met. Same goes for mattresses. And then we've also added food as an ongoing routine expense is not allowable. So 2 points around that to keep in mind. Food, regardless of the type, we'll say, for example, things like baby or pureed food, gluten-free items for daily sustenance remain a typical expense of the family or the caregiver. And food does remain allowable in the event of an emergency need hardship as a one-time allowable expense, which aligns with any of the types of emergency requests that are outlined in the ADM and the allowable, non-allowable list. Moving along to a couple more items that you'll see on the non-allowable list. So batteries, and in terms of batteries, so where batteries are covered by insurance, like for example, wheelchair battery, requests will be denied, and batteries which are not IDD specific or as a routine expense occurred through those of any age or ability, we'll say, for example, AAA batteries are considered, again, a family caregiver responsibility. second bullet on this slide, outdoor recreational equipment. So outdoor playground sets or equipment and swings not specific to IDD are considered recreational items and are still not allowable. We just added a little bit of clarifying language to that item. Continuing along with some of the non-allowable list updates. So the typical expenses or entrance fees associated with some community-based recreational activities. For example, zoos or theme parks. And to keep in mind with this first point, costs of recreational activities that are non-IDD specific are the responsibility, once again, of families and caregivers. So I think the key on this bullet is really that this is really viewed as a more recreational activity and something that, families, of children, whether they have a disability or not, would really see that as something that's expected to be a family responsibility to fund. The next item, clothing as a routine expense if the criteria is unmet. Again, we did dig into clothing on an earlier slide. So this is, again, just pointing out that it's not allowable if the criteria is not met to make it allowable. Ski lessons, equipment rentals, lift passes were moved from non-allowable to allowable. And we also added baby gates as non-allowable. Once again, this item was added to the non-allowable list. It's seen as a basic need and a typical expense, again, that all families or caregivers would incur. This item can also be perceived as restrictive in nature, and that, once again, not something that FSS would reimburse for. Moving into the next section of the presentation are some of the updates and changes we've made to the frequently asked questions document. Starting with number 14 on that list, clarification on requirements of clothing. As promised, did mention there would be more on clothing. 3 points here. If it's requested as a necessity, clinical justification is not required. When directly related to the DD diagnosis, clinical justification is required. And if it's related to behavioral issues, it needs to be noted in the individual's life plan if they have a life plan. And a little bit more information for everyone. When clothing is requested as a necessity, which you'll see more in number 21 on the FAQs, a clinical justification would not be required. But conversely, when the basis for the clothing request is directly related to the needs specific to the individual's intellectual developmental disability, clinical justification and support to this request is required. And lastly, on this slide, if clothing is requested due to those behavioral issues, the plan to address or reduce that challenging behavior should be noted within the life plan. And I think that's again, a point I've made a couple of times during this presentation, but it really is important to stress the importance of that item and making sure that that there is plans in place or things, being done to work with the individual on whatever the behavior is behind, the need for additional clothing. Moving along with the FAQ updates, on number 16, around the clinical justification requirements, specifically when are clinical justifications needed and when are they not. So the question or the FAQ prior to this one, which was not new, but number 15 does provide more of the clinical justification specifics. 16, though, we've added more around the requirements themselves. So if you look at that, you'll see that clinical justifications aren't required when the basis of the request is for a necessity, respite, rec programs, camps, and other items or services not driven by a specific clinical need. Clinical justifications, though, and/or physician orders are required when the need for the item or service was identified as part of a physician or clinical service. And for electronic devices, you can see the physician or clinical service mentioned is section N of the ADM. The electronic devices you can find in section J. So I think that's, again, this is right in the updated FAQs, though, to help people be able to parse out where that clinical justification is required versus where it's not. On our next slide, we've got a few more changes that we made to the FAQs. Number 18 and 19 clarify the definition of the care manager as previously referenced within the document. So there's an important information contained within those two. And then the number 20 is providing the allowability of respite during the caregiver's working hours. So this was definitely, a lot of new language and updates around the allowability, or yes, the allowability of respite. So in terms of the FAQs, I think the key is, routine expenses one would incur in caring for a loved one without a disability or raising a child remains the responsibility of the family or the caregiver. And both the service and the frequency it is provided should be assessed in terms of appropriateness and justifiable need and allocations within a condensed period. So what we're getting at here is obviously it's important to keep in mind how much respite is being used within a certain period of time. So there's an expectation that we'll say a large amount of respite, may be questioned if it's used in a short period of time. Also of note, respite funding shouldn't overlap with Medicaid paid or waiver services or educational programming. So, we wouldn't expect to see someone receiving respite while they were, should be in school or while they're receiving another waiver service. And lastly, around respite, FSS funded respite and respite in general is not intended to offer ongoing long-term coverage for care, but it's really meant to be to provide the caregiver an occasional break in routine caregiving needs. And I think that's why, or I know that's why we really wanted to come out and make a clear distinction on this, since respite is really meant to be a short-term break and not a long-term solution to care. Moving along to the next slide, we have number 21, which better defines the definition of clothing as a necessity. So when we look at, like I said, this clothing and how to better define what's allowable and what's not. Going back to the ADM language, the original ADM language, clothing may be funded if there's specific needs related to the disability. And as I mentioned in the previous slide, some of the things we've highlighted there were excessive chewing, destruction due to behavior, or incontinence, where clothing needs replacement more frequently because of that. So I think that's not necessarily anything new, but I think it's still important to remind people that that's still a big basis for, or still true for when it comes to these clothing requests. In addition, with clothing, clothing as a necessity can also include articles related to health, safety, functional, or environmental needs. And it can also include specifically designed garments for individuals with physical disabilities or medically prescribed clothing articles for which other funding is not available. And lastly, on the clothing point, unless it's sufficiently justified, it remains the responsibility of the caregiver to provide clothing and daily wardrobe needs to children and adults in their care as an out-of-pocket expense. Going back to number 22, clarification regarding self-direction services and multiple FSS providers. All FSS services, including FR and those from multiple providers, count toward an individual's personal resource account. As such, services need to be accounted for in the individual self-direction budget. So it's still, once again, this isn't an entirely new concept, but it's just to reiterate how self-direction budgets need to reflect the FSS piece and make sure that it's properly accounted for. And the last bullet on this slide, number 23, clarifying the use of multiple FSS providers. Ideally, one provider per service type should be used. Basically having one provider to receive all FSS, FR services. But if justified and appropriate, there could be occasions where multiple providers are used within the course of a contract year. And if this is the case or is needed, there would be oversight needed from the regional field office to collaborate and coordinate that to make sure that the individual and the family stay within the $3,000 annual cap. And I think it goes without saying it's very important that the care manager is involved with this and communicating those changes in the individual's needs, status, eligibility, all of the above, to all of the other involved parties. So I think that can be said to go throughout, FSS and other things, but definitely want to make sure everyone's on the same page, because especially when we're talking about reimbursement for multiple providers, it's important to make sure everybody's aware of what everyone else is doing. Moving on to the next slide, a little bit more on the FAQ updates we've made. Number 24 looks at clarifying who can provide respite services. Regardless of the relationship to the person, the respite provider of choice must reside in a separate residence outside of the person's home. Once again, that's not new, but we wanted to stress that again. And this is in order to ensure that the role of the respite provider as a paid giver and not a natural support is clearly distinguished during the time they're providing that service. During the period of respite provision, the provider is defined as the person of choice employed by the caregiver to offer one-to-one paid care to the individual. either within their home or a separate setting as designated by the individual's caregiver. So all of that ties back to the need or the requirement that the respite provider lives separately from the individual they're providing respite to. Moving on to our final FAQ update on number 25. It's regarding the availability of FSS services to people during the eligibility redetermination process. And this is that the OPWDD redetermination process, where there's a period where the individual's eligibility is reviewed and there's a determination if they can maintain that OPWDD eligibility. So in terms of family reimbursement, to avoid any lapse in needed or beneficial supports throughout that eligibility reassessment period, FSS services can continue until the time the final determination is made. This allowance extends to existing FSS programs and services that the individual was receiving or enrolled in. So this wouldn't account for enrollment into newly requested FSS services, which is in line with OPWDD waiver services. If the individual was already enrolled or receiving the service prior to the eligibility redetermination period starting, then they're still eligible for that during that period. Again, there's more information on number 25 on the FAQs document. Next, we'll be moving into some of the considerations for family reimbursement. And I will state, as I'm sure it won't come as a surprise, but all of these next couple of slides is also information that's all can be found in the various FSS ADM documents, whether that's the application, the FAQs, the allowable, non-allowable list, all the tracker even, all of those places is where this information is derived from. As is important to mention, there are limitations to FSS as it's a 100% fully state-funded resource, as well as the regulatory guidelines. Some of the considerations of the following is encouraged when applying for family reimbursement. The things to keep in mind include if the item service is related to the person's disability. Does the item or service help to maintain the family unit? Is the item or service a typical expense a caregiver would normally occur? And is the funding for the good or service a routine or ongoing need? And if it is, how will that be funded if their annual cap is exhausted? And these specifically tie very closely to the application and the FSS tracker. Some additional items to keep in mind: is the item or service the most cost effective to meet the identified need? And in addition to that, is the cost reasonable and appropriate when compared to other similar goods or services? Can the item or service be paid through alternative funding sources? And those would be things such as Medicaid, Medicare, other health insurance, other availability of community-based programs, PHCBS waiver, scholarships. So they're all items or sources, I should say, that should be considered when looking at family reimbursement as an option. Is there a conflict with other services the person's receiving that may prohibit this request from being approved? And something I mentioned earlier, we'll say, for example, if if the individual is looking to receive respite during scheduled school hours or duplicative times of other waiver services, where they would not be eligible for respite per se if they're already receiving another HCBS waiver service. And then lastly, are the items or services, are they considered or perceived restrictive in nature? And that's also another important consideration to take, as we do not want to be, or we're not reimbursing for things that will restrict the individual in any way. So really quickly, the proposed documentation updates, as I've mentioned, there will be comprehensive family reimbursement application instructions that are forthcoming. The application itself remains unchanged though, and this is just instructions to help individuals, families, and care managers more easily complete the application. And our intent is to better clarify the information on the application for ease of access. And the goal is the guidance will better assist those who are new to services, but I'll also say I think it will also help those who have been familiar with it and been using it for the last couple of years. I think a little bit more direction there can help anyone, whether they're new or have some familiarity with the application. So at this point, that's the most current information regarding those documents. But please check back on our website, and we will also do our best to make an announcement when they are officially available. On the next slide regarding documentation updates, as mentioned too, we have proposed changes to the tracker itself. We looked at the columns that were in there, realized that some of them were redundant or unnecessary, so they've been removed. The columns specifically are the DDP1, the review by committee, if the ongoing provide the frequency, does the individual live with the family and or caregiver, preservation of the family unit, alternative funding sources explored, and items listed in the life plan, connection to the disability and why it's needed. Those were looked at and realized we didn't need to have all of those additional columns as well. So once again, as I stated in the previous slide, when those become available, we'll make sure people know where to find them on the website. So without further ado, we do have a few questions and answers we wanted to run through that are outside of presentation itself that we thought would, again, add a little bit more detail and clarity to updates we've made to the family reimbursement program. So Amy's going to assist with asking some questions, and I'll provide some answers.
Okay, if we're ready, first question, can I resubmit an application to request funding for an item which has now been added to the allowable list? So for example, the item was previously denied as a not allowable item, but now with the ADM changes and the list changes is allowable. Can it be resubmitted?
Oh, unfortunately, it cannot. Items or services which were purchased or delivered before the date that the allowable, non-allowable list was made public, which was June 10th of 2024, need to adhere to the guidance that was in effect for that period.
Okay, thank you. Second question, in the FAQ updates, specifically number 20, it states that the FSS respite is not allowable to cover the cost of care during a caregiver's workday. Why is this not allowed? What are working caregivers going to do to afford childcare expenses, especially when it's needed for them to work?
So as I mentioned during the presentation. Respite's a short-term break in caregiving responsibilities for the caregiver. The respite to include FSS reimbursed respites not designed as an ongoing long-term service. Routine expenses one would occur caring for a loved one without a disability or raising a child remain the fiscal responsibility of the caregiver. If these expenses present hardships for caregivers, it may be possible to seek out alternative OPWD funding or community-based resources for assistance. For example, child care resources and referral services or subsidies, Head Start, FSS contracted or school-based after-school programs, etc.
Thank you. How should providers respond to FSS-FR applications which request an item which does not have sufficient clinical justification?
So as an essential step of the review process, FSS providers and their family reimbursement committee would ideally collaborate with the caregiver and the care manager to request that the required justification from an appropriate clinician be provided, and then revisit the application once it's completed. The provider would be working within their discretion to deny and return any application that is incomplete and does not contain the elements needed for a decision to be reached.
Some caregivers may wonder why weren't their child's vitamins covered under FSS reimbursement if over-the-counter or OTC medications are on the allowable list?
A good question, and the over-the-counter or OTC medications as on the allowable list need to be specifically linked to the individual's IDD diagnosis, as noted within the individual's treatment plan, approved by a clinician and denied by insurance. So note that there are occasions where over-the-counter medications may be covered under an individual's healthcare insurance if ordered by a medical provider. Healthcare treatments to include consumption or application of routine OTC medications are unrelated to the individual's diagnosis, but instead needed related to an individual's overall health maintenance, non-related healthcare diagnoses, or routine preventative care will not be considered allowable under this category.
Thank you. Some caregivers also may be wondering if the allowable list for FSS-FR goods and services allows for sports equipment to be funded, then why aren't baseball gloves and bats for example, for their child's Little League participation denied?
Yeah, another excellent question. Not all supplies and equipment for integrated community-based recreational activities will be approved. If the activity is unrelated to the individual's IDD, but instead an activity and cost which caregivers would be responsible to provide for their own or for their other IDD children, then this would not be covered as an allowable FR expense. The information provided in the application should specify how is this equipment, how it's specific to the individual's diagnosis. Also in line with limitations to FSS resources, should be noted that equipment which is not economical, such as top of the line or name brand, may not be approved despite that link to the IDD if deemed an excessive expense and if other more cost-effective goods would meet the individual's needs.
Okay. And lastly, and something that you touched on, but again, families and caregivers may be curious about, is why aren't entry or membership fees to zoos and amusement parks a covered expense on the FSS-FR allowable list, and museums are?
So once again, OPWD recognizes that there is enjoyment and social recreational benefits which come from visiting zoos and amusement parks. However, the enjoyment which comes from these settings is not specific to nor clinically linked to an individual's developmental disability. Fees and memberships associated with visiting these sites will continue to be incurred as an out-of-pocket expense to the caregiver. In contrast, museums that offer direct engagement opportunities, immersive play activities, or sensory stimulation by design are likely to address the needs and correlate specifically to the individual's IDD and would meet the FSS criteria to be allowable for funding. It should be noted that some museums, zoos, and even theme/amusement parks offer discount days, pass reductions, or scholarships toward reduced memberships or entrance fees with approved application or a valid ID, for example, New York State Medicaid or SNAP card. So those were all the questions and answers we had as part of this presentation. And our final slide is the way to reach FSS through the various parts of the agency. The Family Support Services shared email for the FSS unit at central office. Family Support Services at opwdd.ny.gov can always send questions, comments, concerns to that email address, and that comes directly to myself and Amy. In addition, each regional office has their own FSS shared email address that you see here. They're all set up the same way, region number and FSS at opwdd.ny.gov, so you can always send questions directly to your regional field office, and if needed, they collaborate with us and we collaborate with them. So, but there are definitely various ways to reach us with anything FSS related. Thanks everyone for taking the time to listen to today's presentation, and we always appreciate being given the opportunity to provide these updates and additional guidance to all of you. Thanks.